Allô, Nissan? Hey, grosse tempête, hein?
Hey, Karine, oui, je sais, les vilains bonhommes de neige sont de retour.
Mais avec le Nissan Rogue à traction intégrale, c'est pas stressant.
Exact, il est conçu et testé pour nos hivers. Oh, Karine, il y a un bonhomme dans le Rogue.
Ah, c'est correct. J'ai allumé les sièges chauffants.
Ah, bien joué, Karine. Maîtrisez toutes les conditions. Louez le Rogue S 2026 à partir de 0,4% jusqu'à 36 mois, incluant une réduction fidélité de 0,5% pour les clients Nissan admissibles. Jusqu'au 2 mars, sur approbation de crédit, les conditions s'appliquent. Détails chez Nissan.
Well, in the healthcare community, we all know it's all hands on deck. And it doesn't matter if you're a nurse or a doctor or a lab technician, everyone is working to help others in this COVID-19 crisis. And that includes researchers. And they're on the front lines of trying to find if there are some drugs, other treatments that can be used to save lives. That work is happening in Quebec as well, and I'm very happy to have Dr. Jean-Claude Tardif join me on the line now. He is director of the Research Center at the Montreal Heart Institute and professor of medicine at the Université de Montréal. Dr. Tardif, thank you so much for joining us.
Thank you for having me.
So listen, before we get into the drug that you're looking at, I do want to take some time to reference the fact that we're seeing some terrible stories come out from around the world right now of people that have heard, and sometimes from people that they should trust, like presidents of countries. They've seen tweets and remarks, oh, you should try this medication, use this drug, it may be the cure, right? And then they're going out, they're self-medicating. Now we're hearing multiple stories of family in Arizona and all over the place of people that tried to self-medicate with a drug, and now they're dead because of it. But at the same time, we do have to research and look at some drugs that are already on the market to see if they can help out. So tell me about your process, the research you're doing, and why it is so important with all of those things in mind.
You have said it so well, and there's an important public health message in what you said. Without going into politics, I'm going to stay on the ground I know, which is science and medicine. It is crucial that before we implement interventions or before we make comments about this drug or this vitamin or that vitamin, that the groups that make these statements actually evaluate rigorously whether or not the intervention is efficacious and safe. And you're quite right. There have been statements that I think are really problematic because they have international impact. And this is exactly why the reason we are doing this large-scale trial with a specific drug, which is an anti-inflammatory agent. We decided and stated, that the way we're going to do this is not a series of anecdotes or observations of single patients, but rather go to a large-scale study that is sufficiently powered to give a reliable answer to patients, to governments, and healthcare systems. And we're doing this in the most rigorous way, and we realize the urgency of the answer, and we will be as efficient as possible to provide a definitive answer.
And speaking of that urgency, doctor, are you sleeping? How are you getting work that's supposed to be done over the course of 6 months or 12 months? How are you getting it done quickly?
Well, yeah, actually, you're quite right. We did all of this in 7 days, and I tell you, yes, there's a lot of effort, but I'm just representing 125 people that have joined forces, joined hands. It is in this terrible period, at least the human experience is just extraordinary, from nurses, physicians, pharmacists, statisticians, epidemiologists. We have microbiologists, virologists, all sorts of people that have joined forces to put forward hypothesis to make it happen in the field. And I can tell you, it's not only in the healthcare system. In Montreal, you have a Montreal-based company called PharmaScience that has done the extraordinary feat for us of manufacturing more than 200,000 tablets for us to start this study almost overnight. You have CGI, another large information technology company based in Montreal that has designed and implemented a system so that patients can call us 24 hours a day. They can access on the web the documents, the consent forms, and then automatically they're being shipped the drugs. There's TELUS has implemented the hotline. So many people have joined forces for this to happen. And I can tell you, I guess I've received thousands in the last 24 hours of messages, emails of people that want to help. So that's how you make it happen. Not one person at a time, but the community working together.
It really is like a war effort here. We're with Dr. Jean-Claude Tardif. He's director of the Research Center at the Montreal Heart Institute. So, Dr. Tardif, tell me about this drug, and at what point would you use this drug? Are we talking about someone, they're at the hospital, they are close to being admitted, let's say, to the ICU because of COVID-19? Like, at what point do you say, okay, this is a drug that we're looking at to treat, and what is it treating?
Yeah, so, allow me to explain exactly what we're trying to treat.
Yes, please.
So 3 points. They're fairly simple. One, there is a common denominator between what happened in the Spanish flu epidemic of 1918, where 50 million people died, and there were not 8 billion people on that planet at the time. So 50 million people died, and the current COVID-19 pandemic. The one common denominator is that for some reason, children, while infected, are almost not exposed to complications. I mean, it's extremely rare. Mm-hmm. And it is as you get older that you start having complications. Now, why is that? Well, it turns out that one of the possibilities, strong possibilities, is that children, unlike adults, are able to sort of put the brakes, if you will, on the inflammatory reaction much faster than what adults do. Now, second point related to that, if you look at what happened in China and more recently in Italy during the pandemic, it is obvious that at least a subset of patients and potentially a majority of patients get those terrible complications of being hospitalized and intubated and on a respirator and ultimately potentially die from the disease. They don't get that necessarily because there's more virus in their lungs. They get it often because they have what we call the inflammation storm. Their own white blood cells, the patient's own blood cell starts creating sort of a cascade of inflammation that initially was positive to try to tackle the virus, but now it becomes hurtful because now your own white blood cells appear to be attacking your own lungs. And so, thirdly, the final point, just to try to emphasize this point, if you take mice and you infect them with the flu virus and you block their inflammatory reaction, well, there have been studies, very nice studies actually, showing that these mice live longer. And so we sort of put all of that together to say if we sort of dampen the inflammatory or immune reaction, perhaps we could prevent those horrible complications from happening altogether.
In the best case scenario, doctor, if you get this clinical study up and running with as many people as possible and you've got all that support you mentioned before, what is the new timeline, the advanced timeline where we could have some answers here? Yeah.
So it basically is a function of two things. We are planning, we've been very conservative and rigorous. We'd like to follow the patients for 30 days. And second, it's also a function of how quickly we can recruit these 6,000 patients. Mm-hmm. Now, just in Quebec, unfortunately, yesterday there were 500 new cases. The number of cases for a while at least is likely to increase. So it is basically people like you who can reach out to patients and say it is important that you participate because as a community, the faster we recruit these patients, the faster we'll have a conclusion, the faster we will provide the answer to governments, healthcare systems, and patients. So if patients can call this simple number, there'll be a nurse answering immediately, 1-877-536-6837. It's critical, obviously, that you only call if you have a positive diagnosis of COVID-19.
Gotcha.
If you got that diagnosis, you call 24 hours a day. A certified nurse will call you, will answer, and will put everything in motion so that you receive rapidly the medication.
Dr. Tardif, it is I get this positive vibe in me. I'm so encouraged when I get to spend some time talking to someone like you that knows their stuff and can guide us in times like this. I really appreciate your time. Thank you for coming on the show.
Thank you very much.
Once again for the study, the number, again, for those who are positive COVID-19, 1-877, so it's an 800 number, 877 536 6837. 536 6837.